I'm Megan Beardy.
Hello, my name is Zach Van Ross.
Hi, I'm Truco Dabashi Taylor.
My name is Amy Duffert.
My name is DeMarco Petrie.
My name is Tia Andrews. I work at Loyola University New Orleans in the Law Admissions Department.
From not only my own personal experience in education, but also my 6 years as working in public education, I believe that there is most definitely a disservice to students because there's such a lack of mental health support systems as well as programs for youth. Schools nowadays barely have a social worker part-time. They focus more so on behavior than they do on the holistic well-being of a child. And so instead of preventing these issues from occurring, they are more reactive and putting students out, not giving them the resources. So no, I don't think so. I don't think that it's an adequate amount.
I think it depends on, one, what you define as mental health, and then two, what school/district you're in and how severe that student is under your definition.
There's a great lack of mental health in the school system. And when I say mental health, I don't just mean medication, I mean holistically, there's no counselors, there's no training, they're not looking into their lifestyle, their background, their education. Where did this come from? How can we treat it for long-term versus just giving them medication? And I wish that we had more healthcare professionals in the schools that were also more culturally competent to help especially minorities with their mental health issues.
And given the more recent light being shed on school shootings, I think that the majority population is now more concerned about mental illness and mental health in the context of schooling. But as a whole, I don't think that we are giving it the thought that it needs.
It seems like a minimal level, not a high level.
Tell me more.
Well, I'm not experienced in schools, but when I was in school, I remember we did have there was some kind of school counselor, and there was some services, I would say, but I would say in general, no. I would say it's not very prevalent.
Why do you feel that way?
I would say just my experience. I would say, it's out just schools in general. I think mental health is it's sort of a taboo subject. It's something that we don't really like to talk about. And there's a real stigma attached to it. I've experienced that myself when people, if you get labeled like you're crazy or you're emotionally unstable or you're bipolar or you're whatever thing, then it very much feels like a trap. You feel trapped. And it's not a good experience to have, and oftentimes it doesn't feel like there's support.
So my ex-husband is depressed, clinically depressed, has I don't know what his actual diagnosis is, but was untreated, didn't take care of it, and it was really difficult to care about another person and know that they didn't have the capacity to help themselves and want to be there to help them, but at the same time also being able to exercise some self-care and not end up down in that same pit,
I struggled with mental health and depression more specifically growing up, and I think it kind of has its roots in this idea that Black people have to be twice as good. And so at a very young age, I developed a reliance on perfectionism. Everything I did had to be perfect, and because of that, I didn't try new things. If I failed, I broke down into tears. And so on one hand, it made me very critical of myself and my work. And then on the other hand, it paralyzed me, where there were days I literally could not get out.
As far as mental health goes, myself, I have struggled with anxiety and depression, being a part of the foster care system and going to schools in which I was looked upon as somebody who was not going to make it to college. I was not going to make it out of my community unless I was in a coffin or in a jail cell. I feel like the schools had an opportunity to shape me into the person that I am today, and they did it in a negative way, in the sense that positive for me because of the person I've become, but it was because of the lack of resources that they had that I had to go out and seek them from other nonprofit organizations or just people in my community and in my circle, especially the LGBT community, creating families and networks of people to help and support. I felt like I didn't really receive for real mental health training and help and support until I went to UC Berkeley, where I was paying money to go to school. So there was no safety net there for me as a child in public education, which I feel plays into the person I am today.
Money is concerned. The first thing I was thinking when you said that has to do with just the little experience I've had in connection with our psychologists and our social workers, how they, like, there were certain things, that there were certain activities that they had to do that even within the school that they were having to bill Medicaid for. And it just, when you think of like the larger network of government organization, like school is a government organization, but then the fact that and then bringing in that idea of healthcare, you would think that these government entities could interact and overlay and work together, but they're often so at odds, and it's mired in bureaucratic red tape, so things don't get done.
Yeah, so that's a difficult question. I don't know if I can necessarily answer it holistically, but when you asked the question, I immediately thought about, I wouldn't necessarily call them dichotomies, but I thought about two different fields, right? So on one hand, we have a population of students, Black and brown students, who experience systemic trauma. I'm gonna call it systemic trauma, where the systems and create circumstances and environments that induce traumatic experience on a generational level for those particular communities. And so if we're talking about mental health for them, we need to start acknowledging that the system is causing trauma, and from there figure out how do we create mental health practices in schools that serve these particular populations, right? And then on the next end, I'm also thinking about going back to this idea of mental health in connection with school shootings and in the context of schooling, understanding what is actually a white privilege issue versus a mental health
Of course,
issue.
you know this as well as I know this. It will definitely start, fortunately and unfortunately, with the Black church. Because our people, instead of going to actually seek out medical professionals and mental health professionals, we're told to go to the church first, which I think is great. But I think if mental health professionals can actually have a partnership with the African American churches, that it will help with us helping our young folks in high school with mental health issues.
A loving relationship with myself, my own emotions, my own mental health. How can I relate to my own mental health in a way that's both accepting, embracing, but also proactive?
The biggest thing is servicing the child outside of school. There are so many factors that our students face throughout their day, and we're a small fraction when you think about their whole lives. And so if I think about that same student, what did we do to make sure that her mother and her grandmother were able to support those same things that we learned at school? Did her mom get those same services? Are we servicing the whole child? Are we servicing them to check a box? Are we servicing them so that they can behave during the school day? Because our end goal is to get students to be functioning adults. And in order to do that, you need that support in all realms of life. This is how I am at school. This is how I am at home. And of course, there are some things that intertwine, but at the same time, you want to make sure you're servicing the whole child and not just the school version of that child.
Speaking of beliefs, because we have some very poisonous beliefs about mental health in our country and in our communities more specifically. And I need people to check their beliefs and really question why they believe what they do about mental